wanted to talk a little bit today about low literacy and how we might reach our seniors that have either literacy problems or just cognition problems, comprehension problems. One of the challenges that we face is presenting our protect, detect, report message in such a way that our audience understands it. We know the information that we are providing them is important, but if they aren't able to grasp it, then we haven't done as good a job as perhaps we would like to do. You know, it's easy to give a presentation to the Knights of Columbus or to the Rotary Club or to our very active senior groups. But we go out into the public and we speak at assisted living facilities. We speak at some of our senior centers where the seniors are perhaps have begun to experience a decline of some sort. And it's a lot more difficult to put together a presentation that will resonate with that audience. I've got a little fact there from the National Coalition on Literacy that says that seniors and the elderly over age 65 had the lowest average literacy scores of any age range, and those were adults over the age of 18, with 64% performing in basic and below basic levels. And I suspect our volunteers, you all, of course, certainly do not fit in this over 65 category. So it might be surprising to you that there's such a high percentage of seniors that are having some difficulty connecting the dots. We put together last year, and I think we told you all about this, a red brochure, our standard red brochure. We had it rewritten with the help of an adult literacy group over in Lafayette that had us reduce it from, I don't know, I think it was on a 12th grade reading level, and we were able to bring it down to about a 5th grade reading level. So it's much easier to understand all those points about protect, detect, report. And we've had this piece available since last summer, but we never were really sure how we were going to disseminate that information and how to we identify when we were working with low literacy seniors. So I'm going to let Sunny talk just a few minutes about the plan that we came up with.
Well, we know that when I call and request that we come in and schedule a presentation or schedule bingo at these sites, I have this little scheduling sheet that I use, and I fill it out and I take notes as I'm talking to the directors or the activity coordinators. And it, it has the, there's a line for me to put the address and the date of the presentation and the time, and do I need to, how many brochures, how many seniors I'm going to have, and there's a notes section. And Julie and I, we talked about it and we went over it, and finally it just dawned on us that these are the people that we need to ask. We just need to ask them as I'm scheduling the presentations, as I'm scheduling the bingos, which type of information their seniors would prefer, because they're the ones that they're going to know. And so what I do is I've added that to my little sheet that I fill out to ask, would they prefer the easy-to-read brochure or would they prefer the more detailed brochure? So now every time I call to schedule an event, that's part of my process of filling out the form is I ask them that question and I let them tell me which one their seniors will prefer.
And we feel that this is an appropriate way. We knew we couldn't ask the site managers, can your seniors read? Oh my gosh, that's horribly offensive.
Yeah.
And even to say, do your seniors fall into a low literacy category? We thought that was offensive also. But we thought to ask them, would they prefer the easy to read or the more detailed brochure, that was correct and appropriate. Yeah. So, and Sunny has gotten tremendous results. They are always very happy to tell her which the seniors at that site would prefer.
Right.
So you all may notice when Sunny puts out her monthly agenda now, Sunny, are you noticing, are you notifying them?
I am, yes. You'll notice, like last month, I believe that there were several opportunities in EVR, especially that had easy-to-read brochures listed in that information. I know Ms. Pauline Fernandez did a bingo for us earlier this month where she handed out some of our easy-to-read brochures. So it is notated on the schedule now.
And the easy-to-read brochures are available to you if you'd like some. Sunny can send them to you. It is certainly not necessary. This is just an additional arm that we want to make available to our beneficiaries that we're working with, something that might make it easier for them to understand the message that we have to provide. So, so we have the easy-to-read brochure that you are welcome to hand out at locations where they have identified that they would prefer the easy-to-read. But we also thought that it might be interesting to just look at, is there anything we can do to our standard protect, detect, report presentation that might make it a little easier for people to understand? And so as we kind of went through a Google search, we came across some really interesting things that we want to share with y'all. This comes from the Online Journal of Issues in Nursing. And it was an article all about promoting health literacy through storytelling. And I'll just read the screen there. This is a quote. It says, patient education is becoming increasingly important in today's healthcare environment as chronic conditions become more prevalent. Yet, even when education is provided, patients may fail to follow recommendations given by their healthcare providers because they do not understand the information provided to them. And then the article that this prefaces is an article that encourages the use of storytelling to present healthcare information in an easily understandable and captivating manner. Now, this article was not directed at seniors particularly. This was just directed at patients in general, because we know in all age group levels there are people who have less competency when it comes to understanding healthcare terms. And so many of you volunteers have medical backgrounds that you know, the medical terminology is just second nature to you. It's not that way to much of our population. So this idea of health literacy and how much are our patients understanding goes across the board. But we looked a little deeper. Oops, wait. I think I missed a slide. No, I didn't. I'm sorry. So, but we had looked a little deeper earlier, and we know that with our seniors, just literacy in general is a problem. So if we combine healthcare literacy and all the terminology involved therein, and then just general literacy issues, it can be a real problem. I continued to look up different things and came across an article on a website called Inc.com that talked about making good presentations great. And this had nothing to do with literacy. This just had to do with how do we make a good presentation better. And you'll see there it says that good presentations include stories. And we know that all of us would prefer to listen to a story than just a bunch of dry facts being given to us by at a lecture. Great presentations are stories. A great presentation takes the audience through an emotional journey that creates a reason to decide right here and now what to do. These particular presentations were about sales pitches. So, you know, you're trying to get your audience to make a decision. But I think the idea of storytelling applies to what we're doing. And we can connect that yet again here from the Journal of Issues in Nursing again. Someone named Osborne, and I'm sorry I don't have any other information as to who Osborne is, noted that when you tell a good story, you can frame important messages in ways that make them memorable for your listeners. One reason that purposeful storytelling works is because it brings across factual information along with a human interest perspective drawing upon emotions. Emotions in adults are generally derived from past or current events. As adult learners, these emotions play a significant part in the ability to grasp new ideas. Positive emotions contribute to self-esteem, which increases the learner's ability and motivates them to learn. So if we just kind of wrap all those bits derived from different sources together, it makes one think, wow, maybe we should tell some stories in our S&P presentation. So we're going to look at how we can do that. And I want to preface this before we go into this next part of our webinar with the information that this is simply another way to do Protect, Detect, Report presentation. We've got a couple of new volunteers there who may be thinking, oh my gosh, I haven't learned the first one yet. Now she's throwing a second one at me, and that is not what we want to be doing at all. But there's lots of you out there who I know have given our S&P presentation 50 times, and perhaps you're just looking for a different way to do it. There may be some of you out there who are going, you know, I really would like to be able to craft my presentation in such a way that it appeals more to those audiences at the assisted living facilities, or those audiences, you know, who might have a little bit more trouble connecting. So we're just going to give you a very brief run-through as to how you might work a story into your standard S&P presentation. So there's your introduction, of course, and that would be the same. My name is so-and-so, and I'm with Louisiana S&P, so that's all the same. Then you might want to say something like this, that I want to talk to you today about Medicare fraud, waste, and abuse. It is not a pleasant topic, but it's something we all need to know about. So to make it just a bit more pleasant, I'm going to tell you a story. We, of course, never want to tell them to make it easier to understand, I'm going to tell you a story. I think, you know, to make it a bit more pleasant, I'm going to tell you a story. And I just picked a story, and here it is. A few years ago in South Louisiana, I'm sorry, I can't read. Let me try again. A few years ago in the South Louisiana town of Houma, a dishonest businessman, an unscrupulous doctor, and a group of their employees started a scam to steal money from Medicare. They offered the residents at a senior apartment complex a free nutritional supplement. All the senior had to do was provide a Medicare number, and the supplement would be mailed to them. A lot of these seniors were on a fixed income, and they thought, gosh, if I can get something that I can add to my dietary needs that I don't have to pay for, I want to go ahead and get that. Now, you could ask your audience, was it a good idea for the seniors to give the scammers their Medicare numbers? And your audience, because you have already told them it's a scam, they should know that it was not a good idea for the seniors to provide the scammers with the Medicare numbers. Unfortunately, the seniors in that apartment complex in Houma didn't know. They thought the free nutritional supplement was a legitimate program. This particular scam was going on at the same time that we were having a lot of stimulus plans. When was that, y'all? That may have been like 2010, maybe. We had a lot of things going on. It was impossible for, you know, the standard individual out there to keep track of what programs the government really was offering and what programs the government wasn't offering. And these poor folks got caught up thinking that they were signing up for something legitimate. So you'll tell a part of a story, and then you can go straight in to your protect part of your presentation, telling them how important it is to never give their information to a stranger, telling them that their Medicare number is more valuable than a credit card, all of the standard little bits of information that you provide during your normal protect, detect, report presentation. There's just some more of the tips, and we just took this straight from the PowerPoint that we share with all the new volunteers, and this PowerPoint is available on our LASMP.org website. So there's just your standard information that you all already know. So there's a little bit more about protect. Do not help the thieves by giving them your Medicare number. Really important for us to let our seniors know that. So after you've gone through protect, we go back to our story. The seniors in Houma gave their Medicare numbers to the man who spoke to them at their apartment building. A few weeks later, they all received a large case of Glucerna. Glucerna is a health drink, but this Glucerna was made to go into a feeding tube. None of the seniors who received the Glucerna had a feeding tube. They could not drink the stuff because it tasted awful. And I know this because one of the seniors told me that she tried to drink it. And it was, you can imagine how awful, because it had no flavor to it, how awful it was. When one of the seniors received her Medicare summary notice, she read all of the items. She saw that Medicare was paying over $800 a month for the Glucerna that she could not drink. She told the case manager at the apartment complex about this. That leads you right into detect. And you can talk about how important it is to look at your Medicare summary notice. There's information about how often it comes, and if you have a Part C plan, you get an explanation of benefits and what to do. You'll see the last bullet there says, reading the statement is the only way to know if your number has been used to bill Medicare for services that you did not need or did not receive. So back to our story. Fortunately, the case manager at the apartment complex had been to a senior Medicare patrol training, and she knew just what to do. That leads you straight into report. And you go into your standard report telling them to call us, that Sunny answers the phone, they get to talk to someone right away, and that we're connected with them, all the people that we can refer the case to so that something can be resolved. Many of you on the call have heard that story about the Glucerna down in Houma, because that's the one that helped us to catch Dr. Dahlia Kirkpatrick, who of course is in jail today. So it's always been one of our favorite stories. There's just some more information that you would include in your report part of your presentation. The rest of the story. The doctor, the businessman, and his wife were indicted. They went to trial and they were convicted, and they are now in jail. And it all happened because a senior read her Medicare summary notice and reported the problem to Louisiana Senior Medicare Patrol. And that is a true story, and I personally believe that, working stories into our presentation, and especially when it's stories that were very successful, add impact to what we're telling our seniors. Hang on just a second here. I have to switch my slides. So, your thoughts and comments or ideas about the idea of really kind of trying to turn your presentation into a story.
Okay, Julie, this is Dee.
Yes, ma'am.
Haven't been around a while. I do a couple of things. I reference sometimes the stories that you have told us when we were in our training program. The very first one, you told us some particular stories about how Senior Medicare Patrol got involved and, put these people in jail and work with the, the Inspector General, et cetera. So I use some of those stories that you told us a long time ago. But the second thing that I plan on doing now is, I keep a book, and I have all the information that I've pulled off the LASMD, and if I find something in the newspaper here where somebody went to jail because of, I try and send you all a copy, and I put a copy of it in my book, and I always have that book available when I'm doing a presentation. However, you could if you start to keep a book like this for reference purposes, you could read through one or two of those articles of why somebody went to jail, what kind of scam they were working with or whatever, and they would certainly have enough information in there to make up a story right there. But they'd have to go through and pick out some important factors in it to put the story together. But I think that's a great idea. I really do.
Well, Dee, I am so glad that you made those comments, because what we have actually done, and if you all can see on the screen, I'm going to search for something here. We actually put together 4 stories with the highlights in it. And it is, oh, wait a minute, hang on. I'm looking for it in the wrong place. It's on the, oh, Sonny, why is that happening? Hang on, y'all. I'm trying to get to the internet just real quick. There we go. This is in our LASMP website. Miss Nicoletta loaded it on there for us this weekend. And it's something that you all can access and print yourself, or if you'd like, Sonny can print copies for you here, and we can send it to you. But I'm going to just show y'all what it looks like. Oops.
Storytelling. There you go. Storytelling.
Can y'all see this?
Yes.
Okay. Thank you.
Well, not too good.
Well,
just part
yeah.
of the
Yeah, isn't that weird? I'm sorry, I don't know why the whole page isn't showing up there.
Yeah.
But we've got one story about false claims, and you see we've got all the little pieces so you can figure out what goes with protect, what goes with report, what goes with detect, what goes with report, because they're not all identical. There you've got another one about false diagnoses and unused DME. So we're hoping that those of you that are interested in perhaps incorporating this type of storytelling into your presentations will find this particular piece helpful to you to just weave the story through your regular SMP presentation.
Great. Where can we get this now? Do we go online to get it?
Yep, you can go right to the lasmp.org website, which you're seeing right here on the screen. And it's right here. Let's see, it's in the second column here. It says storytelling.
Okay, okay.
Connect it right on there. Anyone else have any comments regarding this storytelling idea?
I think regardless of the literacy level of the people, storytelling is much more effective when you can make it real to the people who are listening.
It has a lot of punch. And I know a lot of the volunteers, a lot of y'all use different stories in your presentation. All that's different about this was, as I was doing the research, was trying to actually make the presentation a story so that you're weaving the story through the presentation instead of just giving the stories, which is certainly what I have done in the past, is just kind of throw the story in here or there, you know. And I don't know if one's a lot better or worse than the other, because I agree with you that telling stories in general just makes your presentation more interesting.
I think the stories where it ends in somebody going to jail, I think they like to hear that really quite a bit.
I agree completely, Jim, and we're getting more and more of those by the day. As a matter of fact, Monique's going to share a new one with y'all in just a few minutes of another doctor going to jail.
Yeah, because I think they really work, and I think it's like the parables in the Bible. So, and it's I've used them. I used the one about the chiropractors, with the sewage and water board. And they like to hear a story where somebody goes to jail.
Yes. Yes.
They like a good ending, in other words.
Absolutely. Yeah,
That's fundamental to storytelling.
That's right.
Happy ending.
We want the bad guys to get it in the end.
That's right.
Yeah, I've told the story about the nursing home scam over in Slidell, where they were billing dead people years later for stuff, and they finally some family member thought, this is not right, this is 3 years after Mama's dead, and they're sending a bill, what's this about? And they started checking into it and found that this was pretty common practice in this nursing home. And they did go to jail, and they closed the nursing home down. So,
well, thank you for sharing.
That outraged the group that I told that to. That's just despicable, killing dead people. So.
Yes, and it's more common than we would like to think that it is.
Oh, yeah. Oh, yeah. If they've got a number, a Social Security number, even if they got it legitimately, and it's hanging around somewhere and it doesn't have a real a live person attached to it anymore. So, you know, I don't know how you do that, conquer that, except that family members need to just be on the alert about any kind of bills that come in and they just don't look right.
Right, right. Which makes the whole reporting aspect of our message so important. It's even if you've discovered it, but you don't tell anybody about it, then we have no hope of stopping it.
Right, right. So so they need to know that there is some place they can talk to somebody about this, and that it will get to the right authorities.
Absolutely.
Yeah.
Anybody else have any comments or ideas they want to share? Well, we just thought that was interesting, and we wanted to share it with you. We hope you all gained something from that, other than having to listen to me drone on for so very long. I'm going to let Monique talk, except that says the sucker list, and that's not what she's going to talk about. So just forget. The sucker list was actually something that Ms. Linda Harkey told us about a while back, and it actually, I did some research on this, and it's actually very prevalent in the UK. It's extremely common in Great Britain, whereby if you sign up, if you get stuck in one scam, your name kind of goes in a database that the scoundrels and scam artists share with each other. And if you've said yes to one scammer, the other scammers are going to call you and ask, and see if they can get you to sign up for their scam. And this is now starting to rotate through the United States as well. Despicable. But Monique's going to share with y'all some nice information about a doctor that's going to jail.
Yes, this article came from The Advocate. It was in the paper on May 9th. And the title is, Psychiatrist Says He'll Plead Guilty in Medicare Fraud Case. And this article is about a Baton Rouge psychiatrist who pled guilty in a criminal case that alleged he participated in a scheme that cost Medicare $37.9 million. He says that he is pleading guilty. He has made severe errors in judgment. And what he was doing, he had some co-conspirators. They were busing people into Baton Rouge from Memphis, Tennessee, and other locations to attend therapy sessions at 2 community mental health clinics here in Baton Rouge. One of them, the name of it is Shifa Community Mental Health Center, and the other one, Serenity Center. Both of them are here in Baton Rouge. And they were taking advantage of the elderly, drug addicts, and chronically mentally ill individuals by providing them with no services at all, inadequate services, and clinically inappropriate services. So he is definitely going to jail. Some of his co-conspirators already pled guilty. And I just want to close it out with what he says. He says, unfortunately, I'm going to be incarcerated. A lot of people in this community stood by me for years. I appreciate every one of them. I definitely don't want this to be the final chapter of my life. But it does sound like it's not going to end on a high note for him. We have posted this article on the LASMP website, so you can go on that website and read it in its entirety.
And we just wanted to kind of bring you all up to date on this one, because our friends over at the Heat Strike Force have been telling us for probably the last couple of years that these community mental health centers are up at the top of their list for scams locally in Louisiana. For a long time, it was the durable medical equipment companies that were stealing the most from Medicare. As the Heat Strike Force started to dismantle those particular
schemes and scams. We then saw a spike in home health, and now the spike is definitely moving into community mental health centers. We also know that there are a couple of other community mental health centers which we are not able to tell you about yet because our friends at the Heat Strike Force are actually investigating them as we speak. Last week, you may have seen there was a big article, I think, in every newspaper in the country because the Department of Health and Human Services announced that they had arrested 90 people in cities across the country who had committed Medicare fraud. This is the first time since 2010 when they started having the Heat Strike Forces that there was nobody from Louisiana included in the list. So Sunny, Monique, and I were just a tad disappointed that we didn't have, any crooks from Baton Rouge in that takedown. We don't by any means think that the reason why Baton Rouge and the state of Louisiana was left off of the list is because we've gotten a handle on Medicare fraud here in Louisiana. We know that's not it. I just believe that some of the big investigations that we are aware of that are going on at the Heat Strike Force simply were not ready to be closed, and so those individuals were just not rounded up in the big takedown that they had last week. I believe it was Wednesday. Mm-hmm. But
I'm going to share an update.
Yes. Monique's got another update.
Regarding the psychiatrist that I was just telling you all about, there is an updated article that says he will face up to 10 years in prison, in federal prison, with hefty fines when he is sentenced August of 28th. So we know that he's going to do at least up to 10 years in jail.
Which is certainly, and we hear a lot about the different scams that sometimes are stealing money. Sometimes in the case of the Glucerna story that I used in my illustration earlier, that was just an inconvenience for those seniors. No money came out of their pocket, so there was no harm done to them. There was harm done to the Medicare Trust Fund, but there was no harm done to the seniors. What's truly despicable about this psychiatrist that Monique was just speaking of is that they actually did harm to these seniors. These were the most vulnerable of our population, people with chronic mental health conditions, people with addiction problems, and they were offering them inappropriate services, which in fact was only exacerbating their conditions and making them worse, not better. But as she said, he's going to jail. Okay, our next webinar there you'll see is June 16th. But before we close out, we've got another 10 minutes, and I told y'all that at the end of the webinar, if y'all thought of anything else you wanted to share with the group, we would have time. So now's your chance.
This is Marietta.
Yes, ma'am.
Is there any way that this can be on local TV stations or in little local magazines that come out, the little weekly magazines or something like that? Like here in Lake Charles on Channel 7, especially the general manager of the TV station, maybe once a week or every so often, he'll get on there and say something special about an event coming up or the legislature, what they're what they're voting on now and stuff, or different things. And I think he may be interested in maybe saying something about the SMP program. Y'all contact them, try to get on TV and stuff? Or
I am not familiar with that particular station, but we would certainly be interested in it. Once a month, we actually put together a little article. It's a very short article that we send out to all the councils on aging and ask them to distribute it however they see fit. And we have seen it in some small-town newspapers where, the director at the Council on Aging has passed it forward onto the little editor of their hometown publication. So they pop up here, there, and everywhere, and I know they also pop up on the Governor's Office of Elderly Affairs website. But we would, Marietta, let you and I talk, later off of the call,
and let's see if I can get some contact information. I would be happy to contact those people to see what they'd like to get from us, and then we would provide that to them.
Okay.
Great idea.
Julie, I'm going to be meeting with somebody on Thursday evening at another meeting I go to, and he's getting an award from another group I belong to, and he is an editor of a North Shore newspaper. It's a weekly thing. Can you kind of send me some information on email? Because his daughter is going to be there doing photographs, and he's going to get an award from us. So if you could send me some information that I could give to her that night, just email me something, and then I'll tell her she should contact you.
I will do that. I'm making myself a note right this minute.
Okay, good.
Okay, anybody else have any comments?
June 16th, 2 o'clock.
Well, we want to thank all of you all for spending some time with us today. Sunny, you will be putting together a summary and sending it out?
Yes, ma'am.
And the summary will have all of the PowerPoint slides attached, just in case there's anything you want to refer back to. And I think if we have nothing else to share, and you all have nothing else to share, go and enjoy the most wonderful weather, because y'all know the heat and humidity